Thank you, Dr. Nazila. The representative of WHO, UNICEF, colleagues from the Ministry of Health, the Fourth Estate, today is your day. Distinguished guests, ladies and gentlemen, good morning. I also want to take this opportunity to thank you for getting time to join us today during this media breakfast meeting on the intensification of routine immunization, or PIRI, or the Rapid Results Initiative on Routine Immunization by the Ministry of Health. And previous speakers have alluded to the fact that immunization is one of the most cost-effective public health interventions, only second to clean water and reduction of disease worldwide. And every year, the Ministry of Health targets to vaccinate close to 1.5 million children against vaccine-preventable diseases such as measles, polio, TB, diarrhea caused by rotavirus, and pneumonia. Over the years, immunization has resulted in at least 70% reduction in the deaths and illnesses from infectious diseases. And as we embark on our journey towards universal health coverage, which is premised on a public health approach with a strong emphasis on health prevention and health promotion with a strong community involvement. Again, this underscores the importance of public health interventions like immunization. And we are going to work very closely with the counties to ensure that this is a success. We are going to utilize the community health volunteers, opinion leaders at the community level to ensure that children who had missed out on their vaccination are reached. And we'll also be able to take this opportunity to trace the defaulters and bring them onto the system and ensure that they are protected. One of the most important vaccines currently available is that for the prevention of cervical cancer, which is caused by HPV, human papillomavirus, a virus that, strictly speaking, is sexually transmitted. And HPV is a unique virus because there are various serotypes or various types of HPV. And the problem with cancer of the cervix is that you can have the infection with HPV and you may not be able to experience any symptoms, yet the damage goes unrecognized. And over a period of more than 10 years, then abnormal changes start taking place in the cervix. Again, which may be asymptomatic for a long period of time. And by the time that the patient comes to see the clinician, we are talking of advanced cancer of the cervix, either stage 3A or 3B or beyond. And that is why the Ministry of Health introduced the HPV vaccine in routine immunization schedule in 2019 to be able to reach 700,000 girls per year. And this is the only second vaccine that we have had against a cancerous process after the vaccine for hepatitis B virus, which protects you from getting hepatocellular carcinoma. And of course, we hope more advances will come into the space so that we can also get other vaccines, including for breast cancer, colorectal cancer, cancer of the esophagus, prostate cancer, etc. And you know, the burden of cancer in this country has really increased, and therefore, if you have an arsenal that can be able to protect and save lives, that is a very welcome plan indeed. Despite cancer of the cervix being the second commonest cancer in the country, it is the number one cause of death amongst cancer patients because the commonest cancer in Kenya is breast cancer. Cancer of the cervix is number 2, but in terms of mortality, cancer of the cervix overtakes cancer of the breast. So again, the need for us to be able to emphasize the importance of our girls 10 to 14 years reaching out. We reach out to them so that they get this vaccine and they are protected. We are going to do this in partnership with other state departments and agencies. Especially for us to be able to reach the girls, we need to work very closely with the Ministry of Education. Although the Ministry of Health strives to reach at least 90% of children with life-saving vaccines, immunization coverage has stagnated at 80%, with some of the vaccines like HPV and second dose of measles rubella falling behind at 30% and 50% respectively. And I'm sure this situation has been worsened by the COVID-19 pandemic because of the mitigation measures that we put in place, including early in the phase of the pandemic, restriction in terms of movement, but also as a consequence of the pandemic, including loss of gainful employment, movement of people from urban to rural areas, and even loss of parents and guardians. So it's imperative that we try to correct this, and I think based on the foregoing, that is why we came up with the guidelines and protocols to ensure continuation of essential health services in spite of the pandemic. We have made gains since then, especially because most of this was affected in the early phase of the pandemic in 2020, maybe quarter one, quarter two, then after that there was a reversal. And this is what we need to sustain and correct and ensure that anybody who was left behind, then during this 100-day exercise, we are able to reach them and correct that anomaly. If you look at the aggregated data, it masks the disparities that occur between region to region, county to county. Especially if you look at the northern arid lands, coverage is still very, very low, and we must make deliberate efforts to be able to reach that key population, because failure to do so, then it means we'll have a significant proportion of the population that is not protected, and therefore a recipe for disease outbreak. The gap in vaccination therefore means that there are several children who do not have immunity against vaccine-preventable diseases, and it is estimated that each year at least 300,000 infants miss critical vaccines. And if you look at the cumulative effect of that, I think we have close to 1.6 million children who are unvaccinated. And that is a time bomb waiting to explode. And we have seen snippets of that time bomb in terms of periodic outbreaks of vaccine-preventable diseases, especially measles. Despite the public health social measures that were put in place during the pandemic, which ordinarily ought to have reduced the incidence of infectious diseases, we have had each and every month we get a report of measles outbreak in one county or the other. And with this critical mass of 1.6 million children who are not vaccinated, if we have a large outbreak that like happened in DR Congo, we are likely to have a very high mortality rate, because most of the children who are not vaccinated are those who live in the rural areas or the urban informal settlements, crowded places, and therefore these are the people who are vulnerable and unlikely to reach the health facilities in good time if you have such a kind of an outbreak. And that underpins the importance of this rapid results initiative over the next 100 days. And the aim of this rapid results initiative is to increase coverage of all childhood antigens, including the second dose of measles rubella, which Dr. Meka showed you there is really lagging behind. We really need to advocate, work with the communities to ensure that mothers bring back their children for the second dose of measles rubella at the 18th month. I don't know how come all along, ever since we started this vaccination program, mothers always believe that after 9 months, that's the end of the visit to the clinics to be able to get vaccines. Maybe we need to get a mantra or a catchphrase so that we can be able to change their process, their thinking process, so that we tell them vaccination does not end at 9 months. There are certain vaccines that require beyond 9 months. And we need to do this in concert with the counties, our partners, implementing partners, and the whole society, because protecting children is protecting our future. Number two, we intend to vaccinate 70% of the girls aged 10 to 14 years with HPV vaccine. How many of you are parents here with girls aged 10 to 14? By a show of hands. Only two. And I'm the third one. So I hope your daughter is vaccinated. If you have a daughter is vaccinated, so two. So for me too. My daughter was vaccinated, I think, 2 or 3 years ago. So it behoves us as opinion leaders, as leaders, health experts, to be able to sell this agenda in all the forums we participate in. I believe now all of us are in 2 or 3 WhatsApp groups. One of the things as part of the advocacy that I want us to do from here is to send a message that we are starting this journey of 100 days of rapid results initiative on vaccination. And one of the groups we are targeting, of course, is girls 10 to 14 years old. So if you have a daughter 10 to 14 years old, please give the head teacher the authority for the health workers to administer the vaccine, or when schools close next week, ensure they get vaccinated. The Ministry of Health has availed all the vaccines in all immunizing facilities, numbering more than 8,000, and we urge parents and guardians to ensure that their children complete the immunization schedule, including the second dose of measles rubella, which is given at 18 months. Any child between 18 and 59 months who has not received the 2 doses of measles rubella should be presented at the nearest immunizing facility for vaccination. And all girls aged 10 to 14 years should be vaccinated with HPV to provide protection against cervical cancer. We are also going to use this opportunity, of course, to be able to train the healthcare workers. Capacity building is key. Also look at our cold chain storage capacity where we need repairs done. I think this will be a good opportune moment for us to be able to see the capacity. And we will continue the advocacy and communication and social mobilization of the public. And of course, periodically, we are going to monitor the performance of this entire exercise. At the mid-cycle, we are going to do a midterm review to see what is working and what has not worked, and therefore to be able to change our direction or strategy to ensure that, plus my entire family. Go ahead. What is it about? No, that is what the boss is going to speak about. The northern arid land countries, especially the Asal counties, have been lagging behind. You know the challenges they have. One, because of their health social seeking behavior, and of course the geographic challenges in terms of accessing the facilities. So we are going to prioritize them to ensure that we reach out to children who have been left behind. As we said in our presentation, every year 300,000 children miss out on these essential vaccines. And this is the gap that we are trying to cover. On HPV, what are the numbers? HPV was negatively affected by COVID-19 pandemic because you see the age group targeted 10 to 14 were in school, and when schools were closed for that long period of time, the coverage dropped from more than 57% to just about 37%. And therefore, we are targeting to reach 70% of the 700,000 girls during this period. Apart from COVID being a challenge, are parents willing to bring their girls for the HPV vaccine? Parents have been willing to bring their girls for HPV vaccine because they know if you get cancer of the cervix, of course, unless you catch it early, the chances of cure are very limited. So if you have a vaccine that can be able to prevent the disease in the first place, what a godsend opportunity for you to be able to ensure that your daughter is vaccinated. And my appeal is to all Kenyans, all parents, all guardians who have girls 10 to 14 years old to ensure that they are vaccinated and protected from cancer of the cervix. Remember, cancer of the cervix is the number 2 commonest cancer in the country, but the number 1 in terms of cause of death. Yeah.
On teens vaccination on COVID, how are the numbers?
Teens vaccination for COVID, the numbers are about 8,000 about. We are approaching now 9,000. Remember, they're only entitled to one antigen, which is approved, the Pfizer vaccine. And I think the turnout is good. We need to work closely with the Ministry of Education and also other institutions of higher learning to ensure that they can be able to access the vaccine.
Will you also be taking the vaccines to schools?
That is, we would rather start by taking the vaccines to those who are at a very high risk of getting severe COVID disease with the potential of death, especially the over 58, those who have coexisting medical conditions. If we can be able to reach those ones first in terms of priority, then at the tail end we can be able to consider taking the vaccines to school. But we are very, very happy that teachers have turned out in their numbers. In fact, they are an impressive second position compared only to the healthcare workers at 91% fully vaccinated. And that is commendable.
And are there plans to start maybe vaccinating those from 10 years?
So far, no justification for our place. I mean, how would we go to 10 years if we cannot be able to vaccinate adults? We are trying to up our numbers for the adults who are eligible. Then progressively we'll go to the younger age groups. Position, of course, Kenya is a democratic society. If you want to go to court, you are free to go to court. But remember, even freedom is not absolute freedom.
The curve, you see the curve is going up. The curve.
Yes. We have noticed the curve going up in the past 1 week from 1% to 6.5% yesterday. So that's a warning sign to us so that we can go back to the drawing board to ensure that we continue to adhere to the public health social measures, but more importantly, that we all who are eligible get vaccinated, because science has proven that vaccination offers protection. So what else are we waiting for? Too early to talk about more stringent measures. We can be able to avert more stringent measures by us simply going for vaccination and also adhering to the public health social measures of avoiding crowded places, avoiding closed spaces, and avoiding close contact.
We're going into election year, and we're seeing the curve climbing. What is the ministry going to do about that?
Countries have conducted successful elections even during the peak of the pandemic. Remember, Zambia did successful elections in Africa without any problem during the peak of the pandemic. If we adhere to the measures and we ensure that we use technology in our elections, we can be able to hack it. After all, us Kenyans were known for being the first in many other things. So I don't think we should have a problem in conducting the elections. And more so now that we have the vaccines. Why don't we all get vaccinated? Then we can be able to have a peaceful, successful elections without any problem. No comment.
Protocols. My name is Ihelma Onwepusi. I'm here on behalf of my WR, Dr. Juliet Nabionga, who is not able to be here this morning, so she requested I represent her and present her remarks. So I'm going to be reading her remarks. They are quite short. And the Ministry of Health has organized this forum to create awareness about an initiative and a strategy at the same time, periodic intensification of routine immunization activities, that it is rolling out across the country for a period of 100 days to increase uptake of vaccines in children and adolescents. Dr. Lucy Mecca has just told us the rationale, objectives, and scope of this activity. This comes at a time when routine immunization activities across the globe have been negatively impacted by the COVID-19 pandemic, giving rise to increased risks of outbreaks of vaccine-preventable diseases. The recent WHO Africa Regional Committee meeting held in August this year noted that system-wide challenges such as inadequate funding, lack of appropriate infrastructure, shortage of skilled human resources, weak supply chain systems continue to hamper sustainable immunization coverage across the Africa region. This, the committee also observed, has been compounded by the COVID-19 pandemic, which has led to disruptions in outreach and fixed-site immunization services, disruptions in new vaccine introductions, planned vaccination campaigns, leading to reduction of coverages of antigens, just like Lucy presented here. Kenya's plan to roll out the 100-day period as a catch-up strategy is a very welcome development, and we in WHO commend the Ministry of Health for this initiative. This will enable children, even in remote and hard-to-reach areas, who have missed immunization doses in almost 2 years of the COVID-19 outbreak, to access these vaccines. We urge all counties to use this opportunity of the little extra resources that have been provided by the ministry and the heightened awareness creation to reach all eligible children and adults and adolescents with vaccines no matter where they are, leaving no one behind. With a global and regional commitment to move towards universal health coverage, we encourage the Ministry of Health to continue to strengthen immunization as an integral component of primary health care and UHC through a people-centered, life course, and data-driven approach, ensuring equitable access to immunization services sustained by appropriate levels of financing and supported by partnerships, technologies, and innovations. We use this opportunity to request that the Ministry of Health take adequate steps to ensure that adequate human resource and cold chain storage space are available to cope with the expanded volume of vaccination activities for both PIRI and the COVID-19 vaccine rollouts, so that neither of the activities suffers. Both are very important activities that require careful planning and implementation. As partners in the quest to achieve our collective goals, WHO will continue to support the government of Kenya, the Ministry of Health, the National Vaccines and Immunization Program in its efforts to protect its citizens against vaccine-preventable diseases. I thank you.